to be looking at controlled substances. There's a lot of information about controlled substances that you need to know and be able to accurately interact with. And there's actually quite a few things that impact the day-to-day activities of a medical assistant as they relate to controlled substances. So let's get an overview of those, and then we'll dive into some of the more specific details. First of all, it's important to use the same vocabulary here. A schedule is a group of drugs that are classified by the Drug Enforcement Agency to have a level of abuse potential. High level of abuse potential to low level of abuse potential. Every controlled substance is placed in a schedule, and every schedule has the unique characteristics about risk for abuse, misuse, and dependency. You should know overall what each of those schedules, sort of what the hallmarks or unique characteristics of each of those schedules are, so that you know how things will change for you as an MA in dealing with them. Memorizing the overall unique elements of controlled substance schedules is easy in some places. Schedule 1 controlled substances are really easy to remember because they are simply all of the illegal controlled substances. That is, it's heroin, methamphetamine, at the federal level, marijuana, any drug that you're not allowed to legally possess for any reason whatsoever, and it has no medicinal use. Schedule 2 controlled substances are the ones that have the highest abuse potential, but they do still have a potential for medical use. And because that category is so special in terms of the differences in engaging in activities related to those, we actually spend some upcoming time looking at Schedule 2 drugs very specifically. Schedule 3, Schedule 4, and Schedule 5 essentially just walk themselves down in terms of abuse and dependency potential. So as you get down to Schedule 5, you're getting close to, essentially you're getting close to medications that have a relatively low potential for abuse, although they do actually have some. In a general sense, the schedules are, Schedule 1 is an illegal drug of any kind. Schedule 2 is a medicinal medication with a very high risk of abuse. Schedule 3 drugs tend to be drugs that are in Schedule 2, except that they're mixed with something else that makes them less likely to be abused. Schedule 4 drugs are benzodiazepines associated with the anti-anxiety agents and those kinds of things, lorazepam, diazepam, Valium, Xanax, etc. And then Schedule 5 is just sort of a weird hodgepodge of drugs that are being classified as a controlled substance with a very low abuse potential. And those are medications like Lyrica and a few other things like that, where there's a small potential for abuse and they're just kind of scattered out there. So we're going to look in the upcoming mini lecture specifically at Schedule 2, pretty significantly at Schedule 2, because that's the medication situation that is very, very different for you as an MA.